The following program is sponsored by Carolina West Clinic. Hi, I'm Queen Johnson, and you're watching Spotlight. Our guest today is Dr. W.C. Verch of Carolina West Clinic, and our topic is neuropathy. Dr. Verch, it's good to see you again.
Thank you for having me.
Yes. Please share with our viewers, what is neuropathy and what are the symptoms?
So neuropathy, and what we're looking for specifically is peripheral neuropathy. There are other kinds as well. So neuropathy is usually caused by a microvascular problem that's going to sort of starve the nerve tissue, causing it to degenerate. So what most people experience are going to be numbness and tingling in the hands and feet, potentially burning as well. Even something called a neuropathic itch is also a possibility.
And this burning and itching, is it constant? Is it intermittent?
It can be either one, Queen. What a lot of my patients say is at the end of the day is the worst. When they're done with their afternoon, whatever the case may be, they'll put their feet up for the day and it just drives them bonkers. A lot of times it'll affect their sleep. They won't be sleeping very well, maybe only getting a couple of hours.
Mm-hmm. And is there a particular age group that neuropathy is associated with?
That's a good question. So the answer to that is not exactly. Now, not all cases of neuropathy have anything to do with diabetes. There's lots and lots of other causes, but diabetes being the most common, it can start at a relatively early age. The youngest I've seen is about 38. The oldest is in his late 90s that came in for treatment.
And so what are some of those other things that would contribute to neuropathy? You said diabetes isn't the only reason.
Well, so we're going to cover a lot of other causes in the next segment. We'll talk about some of the other potential reasons for developing it. So I don't want to allude too much on that. Okay. But what I can say is we know there's about 140 potential causes for neuropathy, and we're seeing more all the time.
And are there risks associated with neuropathy? What are they?
Yeah, so a quick Google search will show that unfortunately every 30 seconds a diabetic loses a limb worldwide. That's not strictly, America, but I will say that diabetes accounts for 85% of the amputations that do take place in America. Mm-hmm. And unfortunately, even more severe than that is 18 to 20% of major amputations don't live another 6 months. Mm-hmm. So coming from me, it's just not worth the risk. If we can get after it while it's less severe, hopefully we can help.
Right. So it needs to be attended to. It's a serious matter.
It deserves your attention.
Right, right. Now, for the folks who are watching who are interested in reaching out to your practice, are you only in Newberry? Are you anywhere else?
Actually, since the last time I was on, we have expanded. We partnered with an office in Lexington, so we're going to be there as well. They're using our procedures. Mm-hmm. So there's now 2 offices. We're working our way towards Columbia, so we're making progress.
That's awesome. Thank you so much
for
being with us. Good to see you again, as I said. Folks, thank you so much for watching. We'll see you again soon on another edition of Spotlight. The preceding program was sponsored by Carolina West Clinic.